Welcome back to our channel. Today, we're diving into an important topic that could help you or someone you love. We're talking about 8 diabetes skin signs you shouldn't ignore. These skin conditions can be early warning signs of diabetes, or they can indicate complications from the disease. So, understanding these signs can empower you to take control of your health or encourage your loved ones to do the same. Let's get started. Our first skin sign is acanthosis nigricans. It's basically a darkening and thickening of the skin in certain areas. Think of it like velvet patches, usually found in body folds and creases like your neck, armpits, groin and even your knuckles. Acanthosis nigricans is often associated with insulin resistance. Insulin is like a key that unlocks your cells to let glucose in for energy. Acanthosis nigricans can be a sign that your body is struggling to use insulin effectively. Insulin resistance is a key risk factor for developing type 2 diabetes. If you notice these dark velvety patches on your skin, it's a sign to check your blood sugar levels and talk to your doctor. Early detection and management are key when it comes to diabetes. Let's talk about diabetic dermopathy, a common skin condition in people with diabetes. You'll recognize it as light brown, scaly patches, kind of like age spots, that often pop up on the front of the legs. These spots are generally harmless and don't cause any discomfort, but they can be a visible clue that your blood sugar levels might be higher than they should be. Diabetic dermopathy is like your body's subtle way of saying, hey, let's pay a little more attention to our blood sugar management. If you spot these light brown patches on your legs, use it as a reminder to check in with your doctor. Moving on to a less common but still important skin condition, necrobiosis lipoidica. This one can look a bit alarming, but don't worry, we'll break it down. Necrobiosis. Lipoidica usually appears as yellow, reddish or brown patches on the skin, most often on the lower legs, shins or ankles. These patches can sometimes be itchy or even painful, and as they progress, they might become shiny and thin, sometimes even cracking open. The exact link between necrobiosis lipoidica and diabetes isn't fully understood, but studies suggest that changes in the blood vessels and inflammation might play a role. If you notice any unusual patches on your skin, especially if they match this description, see a dermatologist or your doctor right away. Early diagnosis and treatment can help manage the condition and prevent potential complications. Chapter 4. Digital Sclerosis, the Stiffness Connection. Let's talk about digital sclerosis, a condition that primarily affects the hands. Imagine your fingers feeling stiff and tight, like you're wearing a pair of gloves that are a tad too small. This condition causes the skin on the back of the hands to become thick, tight and waxy. Over time, it can make it harder to bend your fingers, affecting your grip strength and dexterity. The link between digital sclerosis and diabetes lies in the way high blood sugar can affect collagen, a protein that provides structure to our skin and connective tissues. Early detection and management of your diabetes can slow down its progression and minimize its impact on your hand function. If you notice any stiffness, tightness or thickening of the skin on your hands, reach out to your doctor. Chapter 5. Eruptive xanthomatosis, those yellowish bumps on the skin. Eruptive xanthomatosis presents as firm, yellow, pea-like bumps on the skin, often surrounded by a red halo. They can appear anywhere on the body but are commonly found on the back of the hands, feet, arms, legs or buttocks. These bumps occur when there's a buildup of fats called triglycerides in the bloodstream. Uncontrolled diabetes can lead to high triglyceride levels. With proper management of your diabetes and lowering those triglyceride levels, these bumps typically go away on their own. Work closely with your doctor to address the underlying cause and prevent them from recurring. And Chapter 6. Fungal infections, the itch that shouldn't be ignored. Let's talk about something many of us have experienced: fungal infections. Those itchy rashes that tend to pop up in warm, moist areas of the body, like athlete's foot, jock itch and ringworm. People with diabetes are more prone to these fungal fiends. High blood sugar levels create a perfect breeding ground for fungi to thrive. If you have diabetes, it's crucial to be extra vigilant about keeping your skin clean and dry, especially in those warm, moist areas. If you notice any signs of a fungal infection like redness, itching or scaling, reach out to your doctor. Chapter 7. Bacterial infections when your skin fights back. Let's talk about bacterial infections. These are those pesky infections that can cause our skin to become red, swollen, hot and painful. We're talking about things like styes, boils and folliculitis, those little pus-filled bumps that can pop up anywhere on the body. High blood sugar, especially when it's not well managed, can weaken our immune system. When our immune system is compromised, it's easier for bacteria to invade and cause infections. High blood sugar can also slow down wound healing, making it harder for our bodies to fight off those bacterial invaders. If you have diabetes, pay close attention to any cuts, scrapes or wounds. Keep them clean and dry, and if you notice any signs of infection, contact your doctor. Chapter 8. Diabetic blisters, the blister mystery. Let's discuss a less common but still important skin condition, diabetic blisters. These blisters can be a bit of a mystery, even for us doctors, as they often appear seemingly out of nowhere. Imagine waking up one day and noticing painless blisters on your fingers, hands, toes, feet, or even your legs or forearms. While the exact cause of diabetic blisters is still unknown, researchers believe they might be related to nerve damage or poor circulation, both of which are potential complications of diabetes. The good news is that diabetic blisters usually heal on their own within a few weeks without leaving any scars. It's essential to keep them clean and dry to prevent infection. If you notice any blisters, especially if you have diabetes, get them checked by your doctor to ensure proper healing. Outro? Stay aware, stay healthy. Thanks for watching. If you found this video helpful, don't forget to like, share and subscribe. If you notice any of these skin signs, consult with your healthcare provider. Early detection and treatment are key when it comes to managing diabetes and preventing complications. Stay healthy and see you next time. Kindly like, share and follow us for more.